All eyes on the CDC, where today an advisory panel kicked off a two-day meeting with members voting on vaccines currently recommended for all children.
Yeah, a little later, the committee is expected to vote on whether to limit the use of the hepatitis B vaccine. The panel is also expected to vote on whether to rescind the use of the MMRV vaccine. It's a combination shot that protects against 4 diseases: measles, mumps, rubella, and chickenpox. And then tomorrow, the panel may vote to narrow the recommendation for who should receive a COVID shot.
This two-day meeting comes after Health Secretary Robert Kennedy Jr. replaced members of the panel with other members who have questioned vaccine safety or spread misinformation.
So joining us now to unpack all of this is ABC's medical correspondent, Dr. Darien Sutton. Thanks so much for joining us.
Of course.
All right, so we know the first vote is expected to happen any minute now. It's supposed to talk about rescinding or redoing the hepatitis B vaccine, primarily for children and newborns.
Yes, so let's just to back up to help educate. Right now, as you said, the vote might very well narrow the access to hepatitis B vaccines. That's very important, as hepatitis B is a viral infection that, if untreated and if chronic, can increase one's risk of cirrhosis, liver disease, and the need for a liver transplant and premature death. What we know is that if we vaccinate children in their first 24 hours of life, that can help to protect them against these risks and provide lifelong immunity. Now, what they're voting for is not getting rid of it. They're voting for delaying it for mothers who test negative. What that means is if a mother is delivering a baby and she tested negative during her pregnancy, then the option or the need to get vaccinated wouldn't be there for that mother, essentially. Because the thought is that if the mother is negative, then that reduces the risk of the baby or the infant being negative. And while that is true, if you can imagine, no test is 100%.
Right.
Also, if a mother were to get tested in her first trimester, the risk of getting infected in your second or third trimester still exists. Nearly 2.4 million people live in the United States have hepatitis B. Nearly half are unaware that they have this infection. So that risk not only comes from the mother, but from the household and the community, and puts that child at risk.
Okay. The MMRV vaccine,
Yes.
which I didn't even realize it existed, for 4 different illnesses, right? So what are the changes that might happen with that one?
This is also another confusing discussion. So right now, what is available for parents who come in to get vaccinated is the option to get vaccinated against MMR, measles, mumps, and rubella, and chickenpox, or you can get a vaccine that provides essentially all 4 of these vaccinations together. Now, what they're deciding on is whether or not they're going to allow the combination vaccine. And the reason why they're discussing this is because there is a slight, but important to acknowledge, increased risk of having a fever and having a seizure with that fever with getting the MMRV vaccine. I've treated many febrile seizures during a fever. The majority of those that I've treated come from infections. So it's important to understand where that risk lies. Now, the issue is that if the MMRV vaccine is brought off of their recommendation, that then decreases access to those parents who want to get that combination vaccine. And their recommendations also guide Vaccine for Children, which provides vaccines at no charge to up to 50% of children within the United States. So if that recommendation is rescinded, that might take away access to nearly half of all children in the United States.
All right, so let me ask you this. This is a brand new panel. We know that RFK Jr. got rid of the original scientists that were on the panel. These are new people. Republican Senator Bill Cassidy, who's also the chair of the Senate Health Committee, said that Americans should not trust this panel's recommendations. So what do people do? Because, I mean, we are used to these vaccines, and to have them all of a sudden upend the list of vaccines that we believe that children should have, or at least have the choice to give our children, what should parents do? This
is an incredibly confusing time. I think what's important for parents to understand is that although we've discussed this, there is no new information that tells us that there is a new risk. The same data remains that vaccines are effective in preventing disease. So if you are concerned, understand that there is no new information that was discussed today. I've been sitting in this virtual meeting. Have discussions with your primary care providers and your pediatricians where you trust to treat if you were infected or sick, making sure that you're using qualified data and people who have the background to answer those questions.
But this panel, depending on what they decide, means then insurance companies may no longer pay for the vaccine.
And that becomes an issue of access, which we've dealt with in the past. Unfortunately, we have a risk of going back instead of going forward.
Right.
More to come.